Okay, I think it's time to start now. So hello everyone and welcome to our webinar. It's 7 p.m. in Istanbul and the day started a bit rainy, but the clouds are gone now and there's beautiful weather outside. So most of our participants are from the USA and Canada. So good morning to you and hope it's a lovely morning. My name is Yasemin, and I'm the Business Development Manager of Phoenix Healthy, and we are a medical tourism company based in Istanbul. What we offer is to connect the patients who seek the right treatment from all over the world with the experienced doctors and our top-notch hospitals here in Turkey. And I would also point out that we only work with doctors and clinics and hospitals who are authorized and audited by the Turkish government. And what we offer and what we promise is to be your guide and your company throughout your healthcare journey, starting from the point you apply to us with your medical reports and your medical history. And after you share these with us, we provide you a free second medical opinion from our specialist doctors and a treatment plan and reasonable prices, let's say. And when you decide to come to Turkey for your treatment, we assist you through the entire process. And even after you go back to your country, we're always here. If you have any questions or concerns, or if you want to speak to your doctor, we're always here to help you. We have two representatives here with us. Ms. Özgür Öner lives in Vancouver, and Mr. Ümit Kaya lives in Colorado. And they're always ready to receive and answer your inquiries. So today we have a very special guest. It's a pleasure to introduce Dr. Reşat Aktaş, a highly talented plastic surgeon with over 10 years of specialized experience in lipedema treatment. And throughout his career, Dr. Aktaş has achieved remarkable success, providing life-changing results for his patients. And his patients are not only satisfied, but truly grateful for the care and expertise he delivers. And he's dedicated to improve the quality of life for lipedema patients. So we are thrilled to have him with us today to share his knowledge and insights. Dr. Reşat.
Thank you very much for your very kind words. Yes, today I'm going to give you some information regarding the lipedema. What is lipedema? What should we do in lipedema patients? What's its management, treatment, and post-operative period? I think we can start with the presentation. I'm a plastic surgeon with over 15 years of experience, and I have started performing lipedema surgery for around 10 years ago and treated hundreds of patients from all around the world. Lipedema is a different disease, actually, who has recently recognized lipedema as a disease. Theoretically, lipedema described roughly 80 years ago in 1940s. However, it was an underestimated disease. Thanks God, the social media especially really makes lipedema maybe popular or raised its awareness. At the moment, lots of doctors, dietitians, physicians, and patients share their experience on lipedema. Lipedema is a chronic and progressive fat tissue disorder. This word is important. It's chronic and it's progressive. It starts when you were born and ends when you die. So it's a lifetime disorder. Minimum 10% of women are suffering lipedema. These numbers are average, but it can vary from countries to country. So to be honest, we expect that this number is more, but it's not possible to diagnose every patient. Lipedema has characterized with abnormal and symmetrical fat collection on both buttocks, legs, and arms. Arms involvement is around 30-40%. But generally patients are type 3 and 4. I'm going to tell you what is type and what is stage. Yes, next slide, please. Characteristically, lipedema affects the limbs, arms and legs, especially legs, circumferentially. This illness cause swelling, pain, and make your daily life difficult. Many patients suffer swelling and pain at first. In later stages, lipedema really makes your life very difficult. This swelling is especially you see that at nighttime and after some kinds of especially carbs. If you eat more carb or if you eat more fermented liquids or foods, you're gonna see that the night or the day after you'll have swollen legs. Especially pain makes your life very difficult. The reason is yes, painkillers make this pain less. However, you cannot understand the main reason of this pain. And also it is irrelevant about the stage. Even if you are in stage 1, it doesn't mean that you have pain. I had lots of patients who were in stage 1 but suffering pain. Yes, what is stage? Stage defines the progression of the lipedema. In stage 1, generally it's very difficult to diagnose. The skin texture is smooth. Subdermal area is enlarged, but it's very difficult to understand the nodules because they are not very visible. It can be painful or not, but generally patients who are in stage 1 it comes to our clinic for pain. At the past, this kind of patients visiting all the physicians, but they couldn't have any diagnosis. However, nowadays, when you research the reason of unexplained pain in lower legs, you can easily find the name of the lipedema. And after the patients read the symptoms of lipedema, generally they put their diagnosis on themselves. In stage 2, it becomes much more visible. The disease becomes much more visible. The cellulitis seen is become much more evident, and when you touch your skin, nodules become much more palpable, especially thighs area. And especially inflammation at lower legs causes swelling. Stage 3, in stage 3 patients, you see that especially the excess fat collection, arms and legs, butts become much more serious. So in stage 3, you really understand that there is something wrong because there are lots of bulging, especially inner thighs, inner knee area, and lower leg area. The skin becomes thinner, it loses its elasticity, and after that you understand that you need treatment, but it's a bit late. So you need to visit a physician, please, before stage 3. In stage 4 is the latest stage. In stage 4, lymphedema accompanies to lipedema. So it is really very serious condition. You need an urgent treatment. Yes, the other slide, please. Okay. Yes, you can see here. If you look in stage 1, it's very difficult to understand that there is something wrong. But stage 2, you see that the fat collection, especially thighs, the skin texture, and also the palpable nodules become much more visible. In stage 3, yes, it's sometimes in stage 3, doctors a bit confused if it is lymphedema or not, but there are some differences. In stage 4, yes, it's lipolymphedema. Yes, the other slide, please. What does type mean in lipedema? Type means the locations of the fat. In type 1, just butts and hips are affected. In type 2, butts, hips, thighs to the kneecap area involved. In type 3, full legs involved. In type 4, arms, and type 5, just lower legs involved. Generally, we see type 3 or type 2 and type 4, or type 3 and type 4. It's the other slide, please. Okay, why do some women suffer from lipedema? To be honest, the reason is unknown. We know that 60-70% of heredity is seen. So if we ask to a patient about her family history, they generally say that there is something of her ancestors, aunts, mother, grandma has this issue. Pathophysiology of the illness is estrogen dominance. Especially in recent research show that estrogen receptor imbalance in the fat tissues affects this illness. Estrogen receptor alpha is more than estrogen receptor beta. In that case, the point is the proliferation and enlargement of the fat cells happens. Normally, we accept that after the puberty, there is no proliferation of the fat cells. However, in lipedema patients, especially in puberty, pregnancy, and menopause periods, which the disease become much more visible or progress, fat cells proliferation causes this serious condition. That's why we always tell our patients to be careful about the pills which has hormones inside, like oral contraceptive pills or hormone replacement treatments in menopause period. Yes, the other slide, please. What are the symptoms suggestive of lipedema? So how can you understand that you are suffering from lipedema? Excess swelling, especially nighttime. Bruising. Bruising is, yeah, when you look at your legs, the bruises that you really don't know the reason why. Yeah, I'm trying to tell you that kind of bruises. So because in lipedema, pathophysiologically, the veins, arteries, arterioles are so fragile. So any kind of injury which normally doesn't do bruise can make a bruise in lipedema patients. Pain without any physical reason. I had lots of patients, and generally these patients visited many doctors to find the reason of their pain, because there is no physical reason. If you ask why lipedema patients suffer pain, the reason is intracellular pressure in lipedema patients is high, and this pressure makes compression to the nerves, to the sensation nerves, and this causes pain. So what you need to do is very careful, because especially carbs, gluten, migrates to the tissue and also absorbs water and increase the intracellular pressure, and this pressure causes this pain. So lipedema patients should be very careful about eating and their lifestyles. They shouldn't gain weight because they have very resistant fat cells. If you suffer lipedema, you really understand me that you can do diets, sports, but especially legs and arms, very resistant to diet. So your belly, your back gets smaller. However, disproportionately, arms and legs stand still. And also you feel your legs very heavy. even if you are in stage 1 or stage 2, you can feel your legs very heavy. Disproportional body. So you see that especially in stage 2 and stage 3, your legs and arms are disproportional to your body. Patients generally say that size of my body is, for example, 16, but lower legs is 22. Low skin elasticity. Yeah, one of the more characteristic skin problem is this patient has very low elasticity. There are lots of stretch marks, especially inner thighs and front thighs. This is important because the compression, I'm going to tell you the non-surgical treatment of lipedema. This skin cannot cause any compression to the fat cells. So if the carbs, gluten migrates to the tissue, they absorbs water, but the skin enlarges. So if they have good skin elasticity, that skin cause a tightness like a compression garment and don't let this swelling. But low skin elasticity makes the condition worse. The other slide, please. This is a summary of the lipedema. History, when you look at the history, affected family members, begins at times of hormone weight and shape change, which is puberty, pregnancy, and menopause, difficulty losing lipedema tissue, especially from the legs. Physically, as I told you, disproportionately increased loose connective tissue on the limbs. Symmetric, it's important. Palpable tissue nodules, especially thighs. Painful, abdomen general not affected, limb swelling. Very important, hands and feet not affected. It's important because in differential diagnosis of lipedema, there is one issue, named lymphedema. In lymphedema, feet or hands are affected, but in lipedema, it's not. So, and comorbid conditions. These lipedema patients generally have hypermobile joints as well, especially knees. Loss of tissue elasticity, I told you skin elasticity. Obesity, after stage 2, in especially stage 3 and 4 patients have obesity as well. Some metabolic disorders like thyroid illness. So if your thyroid has some issues, if it doesn't work well, it aggravates the condition. And vascular diseases. In lipedema patients, we need to eradicate the vascular diseases, varicose veins as well. So, and the signs of the illness, persistent enlargement of the legs despite elevation, easy bruising, and vascular fragility. Yes, the other slide, please. Yes, I told the physical signs. Heavy legs, pain to touch or pressure, easy bruising, hands and feet not affected. Calf sign, there is a calf sign in especially ankles and wrists. What does it mean? So your hands and feet come as normal in ankles, not in knees and elbows, but wrists, ankles and wrists, the fat bulging starts very visibly. Negative Sturmer sign is a sign for lymphedema. When you pinch your second toe, it shows us the tension of the skin. And also palpable nodules in lipedema fat, reduced ambulation, decreased social activity. Yes, the other slide, please. Are there any scanning or tests for lipedema diagnosis? To be honest, physical examination is the best for diagnosis of the lipedema. First of all, the shape of the legs. Secondly, the physical examination. In stage 1, it's very difficult to diagnose the illness with just photos, but especially in stage 2, 3, and 4, it's very easy. Ultrasonography is a scanning method which shows the fat tissues Swelling, however, ultrasound needs very expertized radiologists. I have very too much patients, especially coming from Germany. In Germany, lipedema awareness is really too high. Many doctors know the lipedema, and they can diagnose patients with ultrasound. For differential diagnosis, lymphoscintigraphy is necessary if you think there is a low intake of lymphatics. Yes, the other slide, please. Yes, what is the difference between lipedema, lipohypertrophy, and obesity? Especially, we need to discuss lipedema and obesity because lymphedema is really different. So you can understand what is lymphedema. Family history is important. Lipedema family history is 60-70%. Symmetry, yes, both are symmetric. However, swollen feet. In obesity, you see swollen feet, but in lipedema, you don't see it. Disproportion. In obesity, disproportionate is less, but in lipedema, it's too much. Depending on the stage, edema can be seen too much in lipedema, but obesity, it's less. Tenderness is important. Hematoma tendency is important. As you see in the chart, in lipedema, tenderness is too much, but in obesity, there is no. Hematoma tendency is too much, but in obesity, there is no. Influence of diet. If you are just obese, with diet and lifestyle change, you can lose weight. But if you are suffering from lipedema, you lose weight from your tummy belly, but you cannot lose as much as from your legs and arms. Yes, the other slide, please. What are the complications of lipedema? There are two kinds of complications, physical and psychological. To be honest, psychological complications as important as the physical complication. Physically, in later stages, you may have difficulty in walking, hyperflexible joints, varicose veins, and skin color change at inner thighs due to friction. But psychologically, social anxiety, depression, low self-confidence, social isolation, and problems with partners or husbands can be seen very commonly. Yes, the other slide, please. Sorry for the language. This is a quality of life questionnaire which I did to my Turkish patients. It's written that does lipedema affect your daily life? If you see the blue, it's yes, yes. 86% of patients are affected. Yes, the other slide. If it is affected, do you have any problem with your partner or husband? The red is no, blue is yes. As you see, 56% of patients' relationship with partners or husbands are affected. Yes, the other slide, please. And if your relationship has been affected, in which sides? The blue is social, 25%. Red is emotional, 26.5, and the biggest one, the orange one, is sexual, 35%. Yes, as you see, emotional and sexual relationship has been affected over 60% of patients. Yes, the other slide, please. This slide is very important as well. I asked to the patients that what do you see when you look in the mirror? The answer is bad, ugly, disgusting, fatty, obese, fatty, disgusting, disproportional. And there are lots of answers like that. There are worse answers too. It's lipedema's psychological complications, in my opinion, is more than physical complications. Yes, the other slide, please. Okay, so what do we do in the management and treatment of the lipedema? There are two kinds of treatments. One is non-surgical treatments, the other one is surgical treatments. First of all, I'm going to tell you the non-surgical treatment. Yes, what is non-surgical treatments? It's diet. So what do you understand about diet? There are lots of scientific research which has done to lipedema patients show that anti-inflammatory diet or low-carb diets are the best for lipedema patients. I mentioned the reason because the penetration of the carbs to the tissue takes water as well from the vessels and causes the swelling. So you have to be very careful about the carbs, about the gluten and fermented foods and liquids. So you need to do sports. So what kind of sports? Swimming. Swimming is important because, you know, when you dive into a pool or a water or sea, you're gonna feel the pressure. Because in lipedema patients, the skin elasticity is low. So this swimming makes a pressure to the tissues and promotes swelling to goes up with lymphatic vessels to the vessel, to the system. And biking and walking. The reason is when you walk and bike, the movements of your muscles at your legs and calves promotes lymphatic discharge. Manual lymphatic drainage massage, it's very important as well. We recommend this massage after the surgery too. It really helps the lymphatic flow. Compression socks, as the reason why I recommend, or the scientist recommends, swimming compression socks is needed because of the low skin elasticity. And skincare for improving skin elasticity. Yes, you can apply your skin some oils, ointments to improve your skin elasticity. Yes, the other slide, please. Surgery. So what we do in surgery is liposuction. Liposuction means, as you understand, removing the excess fat out, because in lipedema there is an excess fat collection at arms and legs, lower legs, butts, hips. So what we need to do is removing this excess fat. Many scientific research and reports has shown that liposuction has long-term beneficial effects on lipedema. It's been proved. There are lots of, if you Google it, there are lots of scientific research which shows the beneficial effects of the liposuction in long term, especially in pain and leg, and also its improvement in quality of life. The main point is non-surgical treatments cannot reduce the if you ask the what is better, yeah, I am a surgeon, but I'm a doctor as well. So if you put non-surgical treatments and surgical treatments in a scale, surgery is much more heavier, because in non-surgical treatments, yeah, I saw lots of women suffering lipedema and have very good results with diet and lifestyle change. However, non-surgical treatments cannot reduce the pathological fat tissue from the body, but surgery can do it. So you can reduce the amount of fat and reshape your legs with diet and sports. However, lipedema is a chronic and progressive issue. So it's like a tumor, like a benign tumor. So we have to remove this excess fat out to improve your quality of life. Yes, the other, yeah. Yes, it's a bit a confession. Lipedema was an underestimated disease. However, nowadays it become popular. Social media is the main point. Doctors thought that patients were suffering obesity, but it was not. To be honest, in our textbook there was no information about lipedema. We didn't accept these patients as a lipedema patient. We thought that these patients has obesity and denied their request for lip treatment. However, it was not. Legs and especially the lower legs, liposuction has long learning curve. The reason when patients ask research the true doctor, the point is they have some concerns about the result because they are trying to find the most experienced or the not maybe the most but very experienced doctors. In liposuction learning curve, legs and especially lower legs learning curve is the endpoint. So this is the top of the liposuction pyramid. So that's why you need to find really the doctor who is really experienced on lipedema. And also post-op management of the surgery is as important as the surgery. So you need to obey the instructions of the doctor. Yes, this is the end of my presentation. I think there is one question. Can long-term fasting eliminate the fat cells? Yes, I told long-term fasting cannot eliminate, but reduce its volume. Elimination only can be done with reduction of the mass. So if you don't take the fat out, you only see the reduction of the current cell. Yes, our team will give you information about the cost of the surgery.
So thank you for the questions. Actually, you know, everyone's stage and the type of lipedema can be different, and the treatment plan also differs, and it has to be customized. So after you consult with us and after you send us your photos and previous medical reports, we consult with Dr. Reşat, and he gives us the treatment plan, and then we can prepare a quote for you that is customized just for you. And if you need, of course, we include the accommodation and the transfer and anything that you will need while you are traveling here. And as I said in the beginning, maybe you might have missed that, as a medical tourism company, we are always there for you to accompany you and to guide you throughout the whole process, so you don't feel alone in another country having your treatment. You don't have to think about anything other than your health care. So we are always here if you have any questions or concerns. So thank you so much for the presentation. And I think I can show our participants one of our recent patients' testimonial, if it's okay for you, Dr. Reşat.
Yeah, it's okay. Mm-hmm.
Okay. While I'm showing the video, I think also if you have other questions, you can write down on the chat area and we can reply to them after we watch this video.
Hi, everyone. My name is Lynn. I am a Canadian, and I'm just currently in Spain. You can probably hear some roosters in the background. I am sitting here nearly 5 months post-op, having my upper legs done by Dr. Reşat. And I just wanted to say how happy I am with not only the results, but the whole entire process. And I'm going to tell you why. When I was diagnosed, I realized, like most of you, that, oh, I've been living with this for a really long time. I live a very healthy lifestyle. And I still, you know, like all the women say, you know, despite all my efforts, I still couldn't move the needle on these areas. And then during this moment of menopause, my symptoms kind of blew up, and I was experiencing a lot of pain, had to stop doing my yoga practice, which has an effect on my overall well-being. So I did decide to have surgery. And I want to talk about the research process. It's super important you do your research. And I don't know, and I'm someone who does a lot of research in my work, and social media is a tool. It's great, but it's not always where you're going to find accurate science-backed information. You're going to find a lot of things that speak to your emotions. You're going to find groups that maybe have a vested interest, and that means like they're getting a kickback or they're promoting, and I mean, it's great still, there's information, but I just want people to be aware that that's not necessarily where you're going to find all your info. You still have to do the research. You should arrange a consultation with the doctor wherever they are, and see if you connect with them. They're going to be working on your body, and this is, if you ask me, this is a very this condition has a lot to do with our emotions too, and certainly creates a lot of emotions. So you want someone who sees you and who has your best interests, not just the after Instagram shot, although that's kind of what everybody's wanting to look at. So I feel bad for the doctors who aren't marketers, who aren't social media marketers, because all they want to do is help people. And I feel Dr. Reşat is a very humble, super qualified. He's a surgeon. He was the doctor who gave me the information I needed. And I also want to talk about Turkey as a place to go. I mean, Turkey is, it's a wonderful country for a million reasons. The hospitality is incredible, and I could afford to do this for myself. And that is a reality. It's a reality for a lot of us that can't afford to go to the States or Germany or wherever. And so I felt very comfortable. I also want to say, like sitting here 4.5, almost 5 months post-op, and my legs are healing. I feel good. I feel no pain in my upper legs. I still have the tenderness from surgery, but the lipedema pain is gone. I was able to do a lot of things, actually fairly soon after. I didn't push it, but I just returned to my yoga practice. For me, it took a little longer than I'd hoped. But I'm back to that, and I am planning to have my second surgery for the lower legs and the upper arms, and I'm absolutely going with Dr. Reşat and working with Phoenix again, because that's just an extra layer of things I don't have to worry about, and they're just incredible. So I just wanted to come on here and say, for all of you who are considering surgery, it has to be right for you. It was right for me. And I'm really, really glad I did this and I can get on with life. And I'm just going to continue to be a healthy person and try and manage this condition so it doesn't come back in the same way. But we live with it. So every choice you make is a choice for your body, including who is going to perform the surgery. So I'm just here to say that yeah, it was great. And Dr. Reşat, thank you so much from the bottom of my heart. Good luck, everyone.
Yes, Lynn was one of our lovely patients, and actually she really wanted to be here with us today, but couldn't make it. So she wanted to share her comments and this testimonial. So I hope it's helpful for you. So do we have any more questions, or maybe I can ask Dr. Reşat the pre-submitted ones? Okay, I think no new questions. So I will ask one of the pre-submitted questions, Dr. Reşat. So one of our patients is asking, why is skin elasticity important?
Yes, I have told this issue. Skin elasticity is important because it's the outer layer of our body. So if the elasticity is low, it cannot cause pressure the tissue under it. So your legs get swollen more than expected. That's why the skin elasticity is important. That's why you need to wear compression garment or compression socks,
Mhm.
because compression socks does the thing that your skin has to do.
Okay, thank you. And one of the other questions is it possible to cure lipedema completely?
Sorry?
Is it possible to treat lipedema completely?
Yes, it's a very important question because it's a lifelong disease. It's a chronic and progressive disease. What we do in surgery is removing the excess fat. However, it's not a total cure. There is no technique, non-surgical or surgical, that removes all the lipedema cells out and cure completely. So what you have to do after all kinds of treatments, you have to be very patient on obeying the rules, like low carb diet, like sports lifestyle change, not using the hormones, etc. The beneficial point of surgery is we are doing a debulking surgery. In oncological surgery, for tumor surgery, let's say, what we do sometimes removing the excess tumors from the body to make body much more improves its recovery, because think that in your body has 100 cells which your body needs to fight, but if you remove its 60-70%, your body can fight with the remaining 30. It's something like that. For example, if you have 10 cells, but as I told you, we can see proliferation on that fat cells. Any kind of pregnancy or something, these 100 cells can be 120 or 30. So if, for example, have a surgery and remove 60% of 100 cells, you have 40% remaining. So the remaining 40% progress will be very less remarkable than the 100 fat cells. That's why surgery is much more beneficial. But your question is, yes, there is no scientific method which cures the lipedema totally.
Okay, so we have a new question. What do you do if you don't have a doctor in your country?
You need to find another doctor from another country.
I actually want to add something here. So actually why we wanted to organize this webinar with Dr. Reşat Aktaş is that we found out that many people around the world in most countries are struggling to find a doctor who is experienced in lipedema treatment. So they go to some surgeons or doctors that they think can be helpful, but they cannot find the right treatment, and they are actually frustrated. So and there's also a lack of information, lack of awareness. So that is why we wanted to organize this webinar, because in Turkey we have a really good healthcare infrastructure, and we have very good hospitals with the highest quality, and most of them are internationally accredited, and our doctors are very experienced in their areas, in their specialties. So I know it's a big deal to travel from another country to Turkey for a treatment, but that is why actually we are here and doing this webinar, to inform you about our services and also about our expertise. So if you have any concerns, any questions, please feel free to apply to us through email, through phone, or text, and we're always here to answer your questions about it. So we have another question, and it is, can you give average costs? How long is the average time post-surgery to travel back to the home country?
Yes, in Canada, the distance is too much. So you need to arrange around a 10 days trip for totally. So after the surgery, 8 days, 1 week, yes, 7, 8 days would be enough for traveling abroad. By the way, I had many patients from Canada as well, and I really I was shocked when I heard that there is no plastic surgeon in Canada who doesn't perform. Yeah, there is no plastic surgeon who performs lipedema surgery. And for example, in Italy as well, in Italy, I heard that one or two plastic surgeons performs. To be honest, in Turkey, if you ask me how many plastic surgeons, I know 5, 6. So overall plastic surgeons is over 2,000, but less than 1% of all plastic surgeons in Turkey performs this job.
About the average cost, I have to say again that it is really customized for your own condition. But as we have discussed with our patients, I can say that when compared to the United States or to Canada, it must be around 1/5 to 1/10 of the costs over there. So it's very reasonable, actually.
Yes, we have one more question. Do you have? Yes, I have 38. My limit is 38 BMI. Over 38 BMI is a bit red flag for me. So I operate the patients less than 38. Yes, you need to lose weight. Patients generally overweight because one of the comorbidity in later stages of lipedema is obesity. So they say that they cannot lose weight. The point is, yes, I know it's very hard to lose, especially from legs and arms. However, diet is not just for losing weight. It reduces the inflammation. High carb consumption causes inflammation in the body. Yes, maybe you cannot lose much weight from your legs. However, with low carb diets, with healthy lifestyle change, you reduce the inflammation in your body as well. So it is as important as your BMI.
I can answer this new question. What kind of pictures required to make the diagnosis, and who can we contact for quote? You can contact us. We will send you another email after the webinar. You can go through that email to contact us, or you can go to our website or text us or call us any way that you prefer. And for the pictures, we actually send you a questionnaire about your medical history and your general health condition. So it's like a one-page questionnaire that the main information that we need from you. And for the pictures, we need standing up pictures of your legs with a bikini or how you're comfortable. And from the front, from the sides, and from the back to see the general condition of your legs. And then Dr. Reşat reviews all of these information and the pictures, and he gives us a treatment plan and how long you have to stay in Istanbul. And probably there's only one night of admission at the hospital, sometimes two. And after that, after the surgery, you have some MLD massages. And I think it should be 2 or 3 times after the surgery, in 1 week after the surgery. And we also arrange that for you. And we have a very nice hotel that is dedicated to healthcare. So they have 24/7 a nurse and healthcare services and good food for you. Post-op, you can be very comfortable in there. And so anything that you need while you're here, we are always there for you. And also we provide you the garments that you need to wear after the surgery. So I think that's all I need to say about it. We have
Dear Laura, please reply the email that you're gonna have after the webinar and send us your photos, and let me see how is your legs, arms, and your BMI. Sometimes I do exemptions as well. Just I want you to send your photos and information to me via the Phoenix Healthy, and let me see them, and then I'm gonna share my opinion about your condition.
Okay, we are almost completing an hour. So if you have any other questions, we can take them now. And after that, we'll finish. By the way, thank you all for joining, and hope this webinar was helpful for you to be informed about lipedema and the treatment methods and our doctor and how we work as Phoenix Healthy. And please note that we are always here for other healthcare issues also. If you would like a second opinion, it's free of charge, by the way. If you send us your medical reports and medical history and your general condition, we can always help you find a second opinion for any case. Okay, I think there's no other question now. So thank you all for joining. And Dr. Reşat,
Thank you very much.
for the presentation and the information. I hope we see you all someday in Turkey.
Hopefully.
Thank you.
You're welcome. Bye.
Bye.